Okay. All right. So we have heads of the departments here, experts here, but there are also students in the current group. So my presentation will also try to cater to our young youth and upcoming doctors. So it may not be heavy on control studies and all the data. It'll be more tuned to our younger audience, along with a couple of studies that are present. So the renal thrombosis is the same. The pathology, as we're going to see as in the coming slides, is the same as the rest of the body. The eternal problem with the homeostasis. Things happening in clotting happening in places that should not clot, and bleeding happening in places that should not be bleeding. So we're going to look at the etiology, pathology, clinical features, and diagnosis. What are the causative factors of renal vein thrombosis? Now, this is a little bit different from the rest of the body. The pathology could be same, but the predominant etiology and in most cases of renal vein thrombosis can be traced to nephrotic syndrome. Now, for our younger audience, if you can remember that from the pathology, the nephrotic syndrome is described by a cluster of symptoms. Having proteinuria greater than 3 grams per day, hypoalbuminemia, edema, and hypercholesteremia. Now, if you still remember your internal medicine, the most common cause of nephrotic syndrome is membranous nephropathy. The other glomerulonephritis do present with nephrotic syndrome and thereby causing renal vein thrombosis. But the majority will be, so if you see a patient with membranous nephropathy, keep in mind, these patients can clot and have a higher vigilance to start them on anticoagulation. There are certain tumors that can present with the renal vein thrombosis. The predominant and the most common tumor is obviously renal cell carcinoma. So this is the cluster of studies that shows the etiology of nephrotic syndrome and thereby renal vein thrombosis. It shows the various studies that have been done, and it's from the journal Thrombosis Research. You can see that in all these presentations, in all these research studies, the most common etiology is membranous nephropathy, followed by MPGN, and the other etiology factors are less by a factor of almost 2 or 3. So, like I mentioned before, the renal cell cancer is the most common tumor that can present with renal vein thrombosis. The other common causes will be renal transplantation and hypercoagulable states like lupus. Is one of the most common causes of renal vein thrombosis, and antiphospholipid antibody syndrome. We'll be touching about pathophysiology in the coming slides. Like every other thrombosis, including COVID-19 that our speakers have mentioned, it's always the balance between the forces of coagulation versus the mechanisms of anticoagulation. The nephrotic syndrome presents tips the balance towards a hypercoagulable state. Now, it does this because, as I mentioned before, the definition of nephrotic syndrome is proteinuria. One of the characteristics is proteinuria, and you lose certain important antithrombotic factors, like antithrombin 3. So this is this is why the patients are at higher risk of thrombosis. Now, this is one of the studies that have been done to show what is the incidence of VTE, and what they did was they followed patients for 10 years, and that showed the annual incidence of thromboembolism at 1.02% and 1.48% respectively. So the first 6 months of the diagnosis of nephrotic syndrome is the most important period that you have to have a higher clinical suspicion and a lower threshold to diagnose and start them on anticoagulation. Otherwise, they will end up with renal failure and bad prognosis. So this is a little bit elaboration of the pathology that we discussed. In the interest of World Thrombosis Day, this is what happens. You lose the proteins that you need to protect against clotting, like factor 9, factor 10, 12, antithrombin. But in contrast, the high molecular weight proteins like the factor 5, 8, and fibrinogens, the procoagulant factors, they accumulate. So as you can see, the proteins that will protect you from clotting have been, you're losing through the vein, and proteins that will put you at a high risk of coagulation increase during this syndrome. Factor 8 levels increase almost up to 2 to 3 times the above normal levels, which is, as the other speakers have shown you, the clotting cascade. The factor 8 level is one of the important protein in the cascade. And this particular relationship is important because nephrotic syndrome is characterized by low albumin, but fibrinogen does increase. So this difference in the albumin and fibrinogen is one more reason why these patients are at high risk of clotting. So what about platelets? Now the platelets, like in most of the clots, most of the problems with clotting, they go through certain changes that put them to form the thrombin clot. They change their shape, they become more sticky, thereby they're attaching to each other much better. Even the thromboxane A levels go up in these conditions, which again favors platelet aggregation. The LDL cholesterol that these patients have can also cause platelet aggregation. Now, like I said before, nephrotic syndrome may be the predominant factor, but there are less common factors that would contribute to
Looks like Dr. Yougandhar Akula, connection got disconnected. Behind Vijay, can you go for next presentation, please? We will connect back.
No worries. Okay.